Reducing your size of your breast implant. Who would want to do that? Well, actually, a lot of people do, and that's what we're going to talk about. Stay tuned. Breast implant downsizing, that's what we're talking about, Rod. You know, this is, people call it a trend. I don't know if it's a trend. I think it's in somewhat natural progression, but we do see women come in. They may be 20 years after getting breast implants. They don't like the size of their breasts. They want to go down, and that's not uncommon, correct?
Right, and I agree. You know, of course, you're the world expert in breast implants and breast surgery, but I see that all the time, and especially as they've had their children, they age, they want to reshape, get smaller, lift their breasts with a pexy. Yeah, so that's a good thing, don't you think?
And that's the one thing we always talk and educate about. You know, number one, you want to pick implants that fit your breast. And if you do that, we've all seen it over the years. If you have an implant that fits the breast, see that patient 20 years later, and the breast is held up well, it doesn't stretch out as much, things like that, and the patient's still generally very happy. But yeah, a lot of stuff goes on. I mean, people, they go through pregnancies, a lot of hormonal changes as women get older, and sometimes they gain a little weight and the breasts get larger. And what happens is, as the breast gets bigger, sometimes the patients feel like it makes them look bigger or fat, you know, and it's not, they don't like that. They want to have better shape and smaller breasts. You know, there's lots of different things that we can do. We can, removing the implant, that's always an option, but sometimes people don't, a lot of times those people didn't have a lot of breast tissue and they came in and said, they probably are not, a lot of people aren't ideal to remove their breast implant altogether, but they can go to a smaller implant and then they can do a breast lift. And that's some of the happiest patients.
Right, and I think this is one of the times when you say this is a good trend, good trend, don't you think?
Yeah.
Good trend,
Yeah.
2 thumbs up.
One of the big new trends, you know, I think 3D imaging was like the last decade. I think using 3D imaging as a consultation tool and simulation tool. Now I think ultrasound's really, this decade is going to be the growth of ultrasound and plastic surgery for a lot of different reasons, but breast implant surveillance, that's one thing that we've seen with the newer generation implants. And we were ultrasounding these implants and they're intact, and we confirm it, you know, when we do these cases 20 years later, we can say, well, was the ultrasound accurate? And what we're finding, yeah, it's quite accurate. And so, you know, at 20 years, 80 to 90% of the current generation implants are all fine. And they don't need to be replaced every 10 years. That's old mantra. That's like a side, cool educational thing that we kind of learned from this trend.
But it's good. I mean, so we can accurately detect, you know, implant rupture. Implants that are newer last longer, and then as they age, and especially if you've placed them appropriately at the time they had them 15 years ago, they may not need to have them replaced. They just need to have a lift, and I think that's good. So that's a good trend for a change in plastic surgery, right?
Yeah, we see this all the time. It's not because people are having problems. They just want a different look.
Right.
And they do great. So we have great solutions for them. That's great stuff, Rod. If you like this, check out our video on 3D bioprinting of breast implants. It's going to change everything forever.